So I'd specifically gone up to mine and I'd asked her that, is there a place over here where I can, probably volunteer? And she told me that, yeah, we do have something that the university offers. It's a large group. Please go ahead, attend the orientation session. And I remember sitting there watching the clips. There was this very interesting project related to car wash. That's something that I'd only seen in movies. So I was looking forward to doing that. However, I did not get the chance to really wash cars, but I did carry the buckets around. So during that time, I remember my first project was to be a part of the WeCare team. I don't think it's there anymore. It was dissolved in the same year, I think. But it had a lot to do with stage management, event management, and we were being trained by people from Baksha. So that was a great opportunity. And throughout the tenure that I was there in VSO, there were so many occasions where I used to think to myself that, oh, I wouldn't have been able to learn this had I not joined VSO. There were so many workshops, there were so many training sessions. We used to have leadership sessions. I remember that was on the fifth floor of the library. And all of that somehow, culminated into what I am able to do today. So like Anagha mentioned, that I had a history of volunteering. I knew how to do things, and there were some organizations here in Delhi as well. So when I was in school, I used to go and work at those. But because I was a student, there wasn't enough, or rather, they did not, probably take my experience that seriously. There wasn't a significant contribution, but I did whatever I could. But when I moved to college, I thought that, okay, I'm in dental school. I have some time on my hands to actively make a change. And that's when I thought, fine, let me join VSO. So every Sunday, oh, and I did force a lot of my friends to join as well. And they're here on the call. So, probably you can hear it from them later. During this time when I was in first year, after joining the WeCare team, there were a lot of other projects. We used to have Rangat, we had Danutsav, Sparsh. I made sure that I volunteer at each of those events. And so every Sunday, people would ask, what are you doing this Sunday? And I would just say VSO. I loved the feeling of waking up in the morning, knowing that I have a project to go to. And soon, I think by second year, I applied for a position as a coordinator. And soon after that, I was coordinating. I was a coordinator for 4 years, I think. Um, there were several projects that I coordinated. There was blood donation. Um, there was a trip to the orphanage. Every Sunday we would go to this orphanage. And or else, oh, there was another new project that I had introduced called Gardeners Project, which was again, I think, scrapped after that year. But that was a good one where we used to um, spend some time with the children of the staff members at Mahe. So there, the underprivileged children would be there, and we would go visit them, play with them, try to hold some English classes for them, things like that. So I also had a chance to conduct dental camps, medical camps, where now that I think of it, a lot of my insight comes from those camps, not just through VSO, but even as a part of MCOTS during our internship. We used to have our PhD postings, and those have been tremendously helpful. um, Even though on most days, I would go for the Sunday camps just so that I could have a compensatory leave, but I cannot, even begin to express how fruitful those camps were for me. Because after dental school, I did not have a chance to work on ground for the next maybe 2 years or so. And for me to be able to relate whatever I learned during dental school with what I am doing now, I needed that experience. So I'm very grateful that Mahe had that kind of atmosphere, very collaborative, very interdisciplinary. And to everyone here, if you are still studying at Mahe at any of the colleges, please, take advantage of all the facilities that you have. because once you graduate, you're really going to miss that. And there isn't a better ecosystem than what Mahe offers for you to learn everything that you need to learn. I came to college thinking of how I wanted to be a part of volunteering activities, research activities, exchange programs, all of that. I had that on my mind, and somehow in those 5 years, everything just played out. I did not really have to sit and plan it. It was, of course, I mean, whatever work I did in the past 4 years helped me in my fifth year, but it was never about reaching that milestone. It was more about, okay, I like doing this right now, so I'm going to do this in the moment. And VSO was always there. It was for those 5 years, I was always a part of VSO, always participating in the projects, coordinating. However, internship that decreased. But like I said, that during that time, I had the camps to go to. So whatever I am now doing on ground, I think back on those days and I can see the kind of impact that has on what I share, how I communicate with the people, and how. So let me just, come to the part where I moved from dentistry, from academics to entrepreneurship. Again, it was very challenging, and it was not a linear path. So post college, I knew that I don't want to go for post grad in dental surgery. I want to do something that is more corporate, and I started applying for jobs. Did not land anything because uh, it is not easy. A career change, a career pivot right out of college is very hard. Unless you have a degree, a background in whatever field you're applying to, there is no chance that you're going to get a job at, at the, I don't know, let's say Big Four or whatever. That is just impossible. So I worked through that, and I landed up with a job at an investment banking firm, which was far, far away from what I was used to, from what I've done. Uh, it was a very boring 9 to 5 job where I probably did learn how to be patient, but apart from that, I can't really recall. I mean, it was just those memories are not very pleasant. Uh, After that, the pandemic hit, and fortunately for me, that worked out in my favor because I gained more time to work on my skills, get a degree in management, and I, started looking into what entrepreneurship is. And of course, I knew about startups. I had watched Silicon Valley and sorts, but it is very different from what they show on TV. So I started applying for internships at these startups, specifically healthcare related ones. And I found that there's a lot of innovation in this field. Because of the pandemic, health tech had started booming, and it was the right time to join that field. I realized that, okay, this is field that is interdisciplinary, which is what I was used to because of Mahe. And this is something that I want to do. This is where I want to be. This is where I see myself creating a change. Um, but soon after that, I realized that I am not very good at, how should I put it? I did have a leadership position in the startup. I was a digital marketing manager, and it was a Y Combinator startup, which is a big deal. Uh, but I did not feel the fulfillment that I was looking for. I was not content. And then the second wave hit. And again, I had an opportunity to shift my career, to make a transition. That's when I remember April, May, I was struggling. I was barely getting any sleep. I was on call 24 hours and was working as a COVID warrior. We had this organization called COVID Relief India Alliance, KRIA, and there were many other organizations that were a part of it. So we were bringing together all the COVID efforts in India to create a common database which would be verified in real time, and we would be able to provide the help to people who were seeking it. During that time, there were many volunteer groups, and again, there was a time where I reflected and I remembered that okay, so this is what I was missing out on for the past 1 year, 1.5 years. The reason why I was not happy was because I was not volunteering. And the moment I started volunteering, I started feeling contentment. I started feeling that fulfillment. And I realized that that's what I want to do in my life. The corporate it might be something that's lucrative, but it's not something that I am cut out for. I need that aspect of volunteering or contributing to the community in some way for me to sleep peacefully at night. In fact, even during the time when I was working as a digital marketing manager at this health tech startup, I did find platforms where I was able to volunteer using my services. There were a lot of mentorship programs that I had joined so that I could mentor students. There were there were these groups. There was a lot of podcasts and things like that. I can share links of those episodes if you guys want to watch that. Um, but I think the most important thing that I did during that time was creating a platform along with Dr. Ankit Jha and Dr. Vikas. So they are also, you know, alums of MCODs, and we created a platform where we could provide mentorship to students who wanted to move from dentistry to management. And uh, there are a lot of there are a lot of alternate career options that are there, but we often don't get to explore those because of lack of knowledge or lack of resources. And that's what motivated me to create something like that so that people could reach out to me in case they were considering that as an option. Now, a lot of students did reach out, and some of them decided to stick to dentistry, but some of them, the feedback that I received was that okay, I am glad that this exists because I can at least see what it's like. I can at least speak to professionals from the field, from my college, seniors from my college who have tread this path already. They already know about the challenges, the risks, and they can tell me whether I would be someone who should go ahead with it or not, and what under what circumstances. That is also something that's very important. So the group is called Dentists in Corporate or Management Roles. And like I mentioned, that we have a lot of dental surgeons on that group who have either been in leadership positions at corporates or they aspire to join corporates. In case anybody's interested, please feel free to reach out and I can share that with you. So that was another aspect of how I volunteered my services. And a lot of people asked me to monetize that, but as some other people were doing, but I told them that no, this is not something that I intend to gain monetarily out of. It is purely for my personal satisfaction. It's just for contentment, and I would not like to monetize something of that sort. Something where I am providing help. Another thing that happened during that time was that I received a volunteering internship, which I had not heard of because most unpaid internships are voluntary. And this was something different for me. It was more of an academic internship where I was volunteering remotely. I was leading the social media team because that's what my background was in. At that time, I was leading the digital marketing team. And I realized that that particular NGO, it's based out of Delhi and it's working towards healthcare and education. That's when that spark sort of reignited, and I realized that this is what I like to do. This is what I want to do. Now that I have the technical experience, the background, I would like to I would like to merge that with volunteering, with social service. Even while I was working with the startups, a lot of people came up to me and they asked me, why don't you start something of your own? Because we think that you would do a good job at it. But I did not have the courage to. Like I said, the second wave of COVID, it was an eye opener for me. And I decided, you know what, corporates have enough people working for them. Let's do something to create a social impact, because social entrepreneurship is where my heart is at. Another thing that motivated me to go into social entrepreneurship was Jagriti Yatra. It is a train journey. It is usually a physical one, but because of COVID, it's become a virtual train journey where they take you through Middle India, through the states of Middle India, and they introduce you to people who are leading social enterprises. So whether that's Gunj or Akshay Patra, Gram Vikas, all of that, and I learned a lot from their models. I learned a lot from what they were doing. That is also where I met my co-founder, Mr. Sandeep Kumar, who is a cancer survivor, and his story was so inspirational that I just had to be a part of what he was doing. He told me that he's a childhood cancer survivor. He had sarcoma, and he was told that his arm would have to be amputated. It took him 6 months just to receive the correct diagnosis. I'm not even talking about treatment, just the diagnosis. So you can imagine how hard it was for him, for his entire family. Um, they just, they ran from pillar to post looking for the right treatment, right diagnosis, from doctor to doctor. And then finally, he received the treatment that he needed. Now, he did not want anybody else in his village to go through that. And I really resonated with that mindset, because I too do not want people to go through the challenges that I have already been through. And what better than to create something to solve that? Accessible healthcare education has always been on my mind. I just never had a chance to provide that independently. It's always easier to do that with an organization when you're associated with one. I never thought that I would have my own organization and that we would primarily be doing that. But now that I think about it, it's been quite a journey. Also, um, I feel a little strange speaking to a screen. So, uh, I'd be grateful if somebody wants to unmute, or if you want to write something in the chat box, that would be great. If you want to turn your cameras on, that works too. Um, Anyone? Any volunteers?
Hi, Pallabi. This is Shani.
Hi.
Hi. Yeah, very proud of you as a friend for um, addressing us today. And I think it's really great what you're doing. And you are quite, I mean, I would say you are one of the biggest inspirational models I have in my life at the moment.
Thank you so much.
Yeah.
Uh, Thanks, Ashani. Yeah. So I think that's another important component, having a support system, because it's not easy to go through so many transitions by yourself. Uh, I always had the, Mahe tag with me, which is what made people believe that, okay, this is someone who knows how these things work. There's someone who has the experience. And not just that, I came across a lot of people who were from Mahi. In fact, um, when I share my screen, and I'll show you the presentation as well, one of our advisors on board is from KMC. So that was great, building those connects, learning more about social entrepreneurship, relating all of that to my past experiences. um, and then once we managed to build DigiSwast, uh, once we managed to, we have 5 centers now, but at that time we had about um, 3 centers. And I remember it was Dan Utsav. I was so glad to be a part of it because it just took me back to college. I remember being on a call where I think it was a national Ranutsav meet, or it was specifically for Uttar Pradesh. And I remember seeing Anup sir's name there, and I was quite excited to be on the same call as him. So we connected again, and I'm really grateful that he gave me this opportunity to be here to share my journey with you guys. I don't quite enjoy talking about myself at length. So I'm just going to share my screen and tell you a little bit more about my organization, because I feel it's very relevant to um, what we as volunteers should be focusing on. Social entrepreneurship is very rewarding, but there are also some cons, like people always kind of doubting you, your intentions, and of course, the financial bit. So, okay, may I share my screen? I am trying. Okay, great. All right. Is my screen visible?
Yes.
Yes,
Okay.
ma'am.
All right. Thank you. So, this is what our tagline is: awareness, accessibility, affordability, and aid. And it's registered under Section 8 of the Companies Act 2013. Now, the bottom line, I had no idea what it means till 1 year ago. And Section 8 is essentially meant for social enterprises. So these are things that I learned on the go as I was doing it, as I was building the organization. And there are still a lot of things that are new to me. Something that comes with working in an area that nobody is focusing on is learning. You learn a lot of things. You get to learn from what other people are doing. And one thing that I appreciate about social enterprises is that it's more collaborative than corporates, where it is more competitive. And because I am used to being in a collaborative environment, this is what I prefer. Everybody has their personal preferences, so this is not to sway you towards any direction, but this is just something that I would like to share. So this is Sandeep, my co-founder, and like I said, that when he shared how he had opened a telemedicine center, a phygital one, which is a mixture of physical as well as digital, phygital telemedicine center in his village, which was quite rudimentary at that stage, but that really inspired me to work on this problem statement, because I had the experience of working for a health tech company that was already working on telemedicine. um, Anything to do with telemedicine softwares, I from that year at least, I would probably know that. So I did a lot of competitive analysis, and I had an idea about what the market is like, how telemedicine works, what are the different applications, what are the services, what are they providing. So I thought that my expertise can help Sandeep out. Um, a lot of telemedicine companies, most of them are in the nascent stage, most of them are startups, because telemedicine as a concept is something that's new. Even though people were practicing it earlier, it was not as organized as it has become now. So what makes us different from let's say urban players like Practo or 1mg or Apollo, etc., etc., is the fact that they are urban and we are working in rural India. Their models are more app based, mobile based. Ours is more physical in nature. So it has, we do have an asset light model where we just need one room to start a telemedicine center, but still it is a little heavy on the infrastructural side. So it's not entirely digital, but it also has a physical component. Um, I'm very happy to share that we also got incubated under Atal Innovation Mission, and it's supported by Niti Aayog. So this is AICRMP. It's located in Mumbai. There are a lot of different incubators in India, and in fact, even Manipal has one. Feel free to go to the Innovation Center and find out more about it. So there are different incubation programs, and what these programs do is that they provide support to early stage startups. They guide you, they mentor you. but they don't necessarily provide financial support, but they help you connect the dots and provide you access to the market. So if any of you are looking for uh, mentorship or an advisory board, I would suggest that you contact an incubator or an accelerator program. An incubator comes before an accelerator program, so that's the stepping stone. But once you are in an incubator, you understand the validity of your idea, you understand if it's relevant, if your idea has enough traction, um, if the market is how you perceive it to be. So this was the problem that we started out with: lack of doctors. Especially during the second wave, there was a lot of absenteeism of doctors in the primary healthcare centers. I recently went to the CMO's office over there in the rural district of Sant Kabir Nagar, and we had this very insightful conversation where we realized the challenges are more deep seated than we think of them to be. So, coming from Delhi, from an urban setting, um, all of that is foreign to me. But because of the camps that I have been to, I have conducted, I have a fair idea about how uh, how challenging these problems are, and as they should be, as they would be, because India is a large country and we have 60% of our population that resides in these areas that are neglected. So at the centers, the facilities are, it's the bare minimum. They have a telemedicine room, but they don't know what to do with it. The PHCs don't have all those facilities. They have one doctor. All the departments, they have different rooms for different departments, but those stayed locked. Um, so yeah, you can understand what kind of an issue there is. And this is not the case with all the PHCs. This is not the case with all the primary healthcare centers, but in most of them, this is what the issue is. And which is why the government also, they've started mapping the doctors in such a way so that there isn't a single district where a doctor is missing. But again, like I said, that it is a very complicated system. So I feel like achieving that would take more time than it would for us or for people like us to create intermediaries. So our telemedicine center acts as a local node for primary healthcare. And what we provide is that we can provide quality treatment in your village, and you don't have to travel long distances for it. You don't have to wait for several hours. You don't have to stand in the queue and wait day after day. So this is our advisory board. And like I mentioned that Dr. Sabine, she is from KMC Manipal. So, the Manipal connection always stays. This is a mission that we're working on, making healthcare services affordable and accessible for rural communities across India by leveraging technology. This is our board of directors. This is Mr. Sandeep and Mr. Santosh. Now, these are our telemedicine centers. Unless you see one, it's very difficult to visualize what it looks like. So this one is DS1 is in Uttar Pradesh. We have one in Bihar, one in Gujarat, one in Pune, and the most recent one is in Mumbai, which is specifically for migrant workers or other marginalized communities. Now over here, you can see that we need a physical space, and I will tell you more about how it looks on the inside. So these are the services that we're providing. Telemedicine, we have awareness camps, we provide EMRs, which is the electronic medical record, and we also provide them with digital prescriptions. We have referral networks with hospitals, and there is a focus on cancer, of course, because a lot of our a lot of our centers are being run by cancer survivors or their family members. Now, this is how the teleconsultation takes place. The patient walks in, and there is a patient navigator who would measure the patient's vital signs. So they measure the pulse, oxygen saturation, blood pressure, temperature, and then they convey that to the doctor. This is done through the telemedicine software that we have. An electronic record is also generated and it is uploaded to our cloud, which is safe and secure, so that the next time the patient comes back to us, they are able to access those records. Or if we refer them to another hospital, the doctor over there can see their records. And this is very much in line with the telemedicine guidelines of 2020, which was released in March by Government of India. So all of the protocols are followed. Uh, right. So after the teleconsultation is over, there is either a prescription or a lab test that the patient needs to get done. We send them to the labs, we send them to pharmacies, and we have a tie-up with these pharmacies or labs where they provide a 50% discount to our patients. Now, usually what happens is that in the healthcare system, there is, uh, well, you have the commission basis. So instead of taking that fee and keeping that with us at the organization, we provide that benefit to our patients. Um, Apart from generating the prescription or getting their lab reports done, we also provide them with referral pathways, like I was talking about earlier, to hospitals. Because what happens is that at the primary healthcare level, people always wonder what next. What is the next step? What do I do after this? Okay, fine, the consultation is done, but what after that? And that's where most patients need the support. So we also accompany them to these hospitals, whether that's in Mumbai or Banaras or Lucknow, and we provide them with the care that they need. We connect them to the social work department that's there in these hospitals, and over there further, we coordinate with the doctors that we have on board, and we ensure that the treatment is completed. We also help them with documentation. So there is Ayushman Bharat card and other schemes by the government, which helps them receive some funds, whether that's PM fund, CM fund. We help them apply for that, because what we need to understand is that this population is the poorest of the poor. They are residing in very remote regions of India. And in these villages, documentation is something that's foreign to them. So when we ask them about, the previous medical history, medical records, what drugs they're on, they have no idea. They just say that, oh yeah, I had a slip, but I lost it somewhere, or it got wet in the rain. I misplaced it. It was 15 years old. So that's why having that baseline data is very important, and which is why we're trying to do things digitally. We're trying to keep all of this recorded so that they don't have to go through this entire process again. These are some of the cases. Over here, you can see an oxygen concentrator. We had 6 oxygen concentrators during the second wave donated to us. This is, we also have medicine distribution, ration distribution, and this is a teleconsultation that's going on in the first image that you see. That's the teleconsultation room. We have a partition which provides privacy, and so there's a lot of stigma involved, right? In the villages, they have issues with the caste system, and there is the families over there, they don't really allow the women in the family to go out of the house. There are so many people over there who haven't been outside of their village, and these are some on ground realities that are challenging when we think of such interventions specifically for them. So that's why we have an all-female staff, at least at our Uttar Pradesh center. We try to have a female member at every center so that the patients and the families are comforted. They have that, you know, uh, they feel secure about the kind of environment that they're sending their members into. And like I mentioned, so far we have 5 centers. We have 90 plus healthcare professionals on board, and some of them are from Manipal. We have tied up with 18 diagnostic centers, 10 pharmacies, 9 hospitals. Awareness camps, this is some old data, so this has increased now. It's beyond 100. And patients served, again, this number has increased as well. This data is till the 31st of January. Nowadays, fortunately, we have been receiving requests and queries to the beat of, let's say, 1,000 consultations per month, since the number of centers have also increased. This is a comparative analysis of how much time and money the patient saves if they visit the local Digiswast center versus if they have to travel longer distances, if they have to go to a nearby city like Gorakhpur to get the treatment done. These are some of the success stories that we have, and you'll see that we do have cancer survivors also whom we've helped. We have a rigid follow-up system in place where we call the patient after 1 week to ask how they're doing, if the medicines worked, if they took the medicines at all. It's not surprising, but it was surprising to me to know that the patients don't even have money to afford the medicines. So then we tied up with other organizations. Like I said, the social entrepreneurship space, the non-profit space, it is so collaborative, and there are organizations for every problem that you can think of. And if there isn't one, I would urge you to create your own organization. So we tied up with people who could provide us with the medicines, and then we further, donate them. And there are other organizations that are very helpful. Like I said, Gonj, they have been supporting us with the infrastructure, with furniture, things that you can't even think of. So from the Delhi office, they sent us fans for our Uttar Pradesh center, and it's very heartening to know that there are people out there who want to help beyond their means. These are some images of our door to door campaigns. You can see our team members going from door to door, conducting the vital tests, and they having a campaign over here. We also had a couple of webinars during the pandemic when the on ground work had decreased. So that time we were focusing mostly on the pandemic and providing oxygen concentrators, oximeters to the patients. These are few awards and achievements and media coverage. These are some of the doctors that we have on board. Now, this is something that I would like to focus on because it talks about the kind of impact that you can create. Now, we also have a line at the bottom which says we welcome in kind support. So, there are a lot of people who hesitate to donate in terms of money, but you can also provide us with medical devices, laptops, tablets, TV screens that we need. Um, there are also volunteering opportunities at DigiSwast. So, if you have the time to, if even if you have a month to spare, please go ahead and apply for those, or you can just contact me and I will help you out with that. Mostly, what we would like to focus on is volunteering opportunities for the urban crowd for people who are educated and tech savvy, because that's the kind of support that we need. Our on ground team is a strong one. Fortunately, very proud of them. They're doing some great work. But where we're lacking is um, the technical aspect, or let's say marketing, things like that. So even though I enjoy marketing, I am not able to devote that much time to that. But if any of you would like to volunteer with us, go ahead and apply for the opportunities. Yeah, these are some ways in which we ask other organizations to help us. So we collaborate with them and try to open up DigiSwast telemedicine centers in their village. Again, if any of you have family members in the villages, or if you want to do something for the district that you belong to, please feel free to contact me and we can probably work something out. Yeah, that's all. Thank you so much. I'm open for questions, comments, any feedback, anything that you would like to share.
Hi Pallabi, this is Chavi.
Hi, Chavi.
First of all, I'm so proud of you, such an inspiration to all of us. And I do have a question. What message or advice, rather, would you give to a young person or a student who wants to get into volunteering and help society, but is hindered by society and parents, because there's no financial security? So what advice would you give, since you have been through this journey? And I know so many people who want to go through this, but they're like scared because that paisa nahi milega wala uh, thinking is there.
Okay. Thank you, Chavi, for that question. They're not wrong. The paisa nahi milega situation is very real because, like I said, that the social enterprises are not as valued as corporates are, and everybody's looking for that package, which you don't receive when you are in this space. So there is a lot of convincing that needs to be done, and there is always that thought at the back of your head that what if I didn't step into this field? And I've spoken to other social entrepreneurs, and I know that they all have the same complaint, lack of funding. For them, for people who want to get into space, I would like to tell them that it is not easy. It is going to be very challenging. If you want to step into this, be prepared to work hard and to go through lows. But trust me, the highs are equally rewarding, if not more. And the family societal pressure that's there. Even I have that because, in fact, not even just the family or society, but even donors. I remember I was speaking to a donor, asking them to fund, some of the expenses, and the person told me that I'm not convinced. I'm not convinced because you are telling me that you're a dental surgeon and you have a degree and you have a managerial degree. I'm not convinced that you want to do this, that you're doing this in the long term. And I was just, I was flustered because a random person is questioning my beliefs, my ethics, my principles. So, like I said, that it is difficult, but when you think about it, the bigger picture, um, when I think about how my efforts have been able to seep through so many villages, it makes me feel happy. It gives me that satisfaction. And um, this is not a space for people who are looking to mint money. It's not. And I understand that everybody does not have the financial security to go through with it. Even I don't. But I hope to make it, build it to that level where finances is not something that I need to worry about. You know, like people always say that if not you, then who? So if there is a problem statement that bothers you, that keeps you up, I feel like it is worthwhile pursuing that. And again, like I mentioned, that this space is very collaborative. So there is always going to be someone there to guide you. And if you need any of those connects in the social entrepreneurship space, feel free to reach out to me because I can help you get in touch with the people specifically for healthcare. So I know a lot of people who are in the tech space and uh, people who are in healthcare education. So if any of those fields interest you and if you want to explore that, the best way to go about it is go for an internship, go for a volunteership at these organizations, learn how they work, see if you are able to fit in, and see if they think that you would be a right fit for them as well. It goes both ways. So yeah, I mean, just go for it.
Thanks a lot, Pallavi. I'll be contacting you for any future volunteering I want to do.
Sure, always.
Hi, Pallabi, Ramya this side.
Hi Ramya, I read your message. Thank you.
So, as someone who also works with cancer patients, I just wanted to know if your company deals with helping them post-operatively, because
Yes.
I know for a fact that their quality of life takes a huge hit. So, does your company help with rehabilitation or, helping them with livelihood stuff like that?
Yes. So thank you for the question. It's very important for cancer survivors. Before joining DigiSwast, I was not even aware that there are so many organizations working solely for cancer survivors, and they're run by survivors, and the stories are so inspirational. Ramya, I met a cancer survivor who had breast cancer, and she just completed 8 cycles of chemo. And I was asking her to narrate her story for a video testimonial, and at the end of it, we were all so inspired that we just automatically started applauding, and she was in tears, and I can't explain that. I cannot explain how it felt to know that we were able to help her. And yes, we do provide support to people who have just been diagnosed with cancer. So there are about 95 patients who have been diagnosed with cancer at our centers. And imagine this is in the villages and with just 4 centers. Um, there are also people who come to us for follow-up appointments because they are in the villages. They cannot go for follow-ups to the hospitals. They don't have the money to afford not just travel but also stay, because a survivor would not go by themselves. They need a family member to accompany them, and that increases the financial burden. So they, instead they just prefer staying at their places and suffering. Now, to combat that, we provide follow-up appointments for our patients at our centers. We are connected to Tata in Banaras, Tata Memorial Hospital in Mumbai, and a lot of other non-profit organizations like We Care Foundation, or Spain Sarcoma, or there's so many. Ugam, there's KCK, which Sandeep was the president of. So yes, we are aware of the challenges that they go through, and we empathize with them. If you have any patients who need support in that regard, you know what to do. We, because a teleconsultation has really helped with that. There are survivors from all over India who are connected to us, and in fact, that is cancer is something that we are actively working in. That is one of our focus areas. Um, we also help them with funding, like I'd mentioned during the presentation, that it's not that we provide them funds, but we can raise funds for them. We can connect them to the social work departments or help them with the documentation that is needed to receive these funds from other organizations.
Thanks, Pallavi. I think I've heard a lot of my batchmates in other departments who said that they have lost patients to follow up during chemotherapy and radiotherapy. But that's something that needs to be looked into. So great that you're
Yes.
doing.
Yeah, sure. I mean, if they are in any of the places where we have our centers, in fact, even if they reside elsewhere, we can definitely get them on a teleconsultation with the doctors.
Thanks a lot.
Good evening, everyone, and good evening, Pallavi.
Good evening.
Kirtilata here.
Yes.
I sat through your presentation, and it was really a very humbling experience for me. The little Pallavi that we knew in MCOTS is the co-founder of a very noble organization. It feels so good, and hats off to you. And in a small time, you have done so much. That's really very, very commendable. We all at MCOTS are very proud of you, and we wish you all the best. We will try and help you in whichever way we can.
Thank you so much, ma'am.
Thank you. Thank you so much, Pallavi, for this talk.
Thank you, ma'am. It means a lot coming from you. And I would just like to share that the MCOTS family has always been there to support me. So whenever there is an update, I share it with them. And
Yeah, of
the
course.
support system is very strong.
Yeah.
Thank you so much.
Thank you. God bless you.
Thank you, ma'am.
We have a few more minutes left, so maybe we can take 1 or 2 more questions. So please go ahead.
In the meantime, is it okay if I share a few links in the chat box?
Yes, ma'am, please go ahead. Of course, yeah.
So here you can see more, I mean, in case you're interested, you can read more about the organization. You can read about my profile or ways to connect with me. Anything's fine, Instagram, LinkedIn, wherever you're available. And apart from that, yeah, if there are any medical professionals who are listening to this, I would request you to join our board. There is no compulsion, there is no restriction, no limitation on the number of hours that you need to contribute. You are, free to come in whenever you want. There is no schedule as such, but we are in dire need of general physicians. So if there's somebody who would like to come up, you're most welcome to.
Uh, Yeah, thank you so much, ma'am, for being so candid and providing such a wonderful insight into your stories and experiences. It was wonderful to hear about how your activities at VSO actually influenced the shift in your career path, and we feel really proud to have been an integral part of your journey. And I personally found it very appealing as well, being from a healthcare background myself, and also somebody who is motivated to serve the community in that regard. So I think I will be looking at those volunteering opportunities that you provide, and I think I will be signing up for it as well. So I think it was really really wonderful having you and here and talk to us about your experiences. And I'm sure that all of us really enjoyed your talk. And it was very memorable, and I will, keep it in mind. Yes, ma'am, thank you so much for having, for talking to us for this long. And thank you everyone for joining in as well. This was really nice having you all. Thank you.
Thank you so much, everyone, for joining in and for the kind feedback. I'm looking forward to connecting with you all outside of this meeting as well. Thank you.
Thank you, Pallavi.
Thank you, ma'am.